Hello, my name is Garcia, and I'm presenting our research paper, Learned Helplessness and Mental Health Issues Related to Distance Learning and COVID-19. As everyone knows, the spring semester of 2020 was one of the most unanticipated spring semesters for all students. The rapid switch to remote platforms in response to COVID-19 forces students to transition from in-person learning to online learning with little to no time to adapt to the new learning technologies they would be using. This was our first COVID semester. Our research paper will discuss if students experienced learned helplessness in regards to new online learning technologies and if students' mental health was affected due to this transition. Our first research question asks, to what extent did the COVID semester create feelings and behaviors of learned helplessness with regard to online learning technology? Our second research question asks, to what extent did the COVID semester impact mental health? Our hypothesis was, students will experience feelings of learned helplessness regarding online learning technologies and suffer from an overall poor mental health. We conducted pilot interviews from which we pulled our first order themes. We then put these first order themes into second order themes. These second order themes then became the basis for our survey questions. We sent out the survey to a large portion of ACU students' population. We received a total of 115 responses. 9 of those were invalid because they were first-year students who were not on the campus during the semester in question, giving us 106 usable responses. This survey consisted of 15 questions. These questions were designed using a 5-point Likert scale. After collecting all survey responses, we conducted an exploratory factor analysis with 6 factors. We then ran a multivariate ANOVA test on each factor, where the dependent variable in each factor had the highest factor loadings. We divided these 6 factors into 2 groups based on their themes. The first group's theme was learned helplessness with regards to online learning technology. The second group's theme was mental health. In response to research question 1, we found that relatively few students outright experienced learned helplessness with online learning technologies. However, many students reported experiences that could contribute to learned helplessness as shown in our factor analysis. In response to research question 1, we found that many students struggled with mental health due to their isolation and their environment after the rapid shift from in-person to fully online learning. This study should help universities around the world better understand the effects of online learning technologies on their student body and make adjustments to enable their students to be more successful. Finally, our results agree with prior work that interactivity and community in online class formats are key to student engagement. It would be beneficial to study these methods instructors use to make their courses more interactive while online, and how these strategies interacted with the factors observed in our studies. There were limitations to our study. The sample size for the interviews was small, but this is to be expected for exploratory interviews. The sample size for the survey was small, but was still able to yield interesting and statistically significant results. There were no LGBTQ+ respondents in the survey, potentially biasing its findings in areas such as mental health, which is typically more at risk in LGBTQ+ individuals, especially during the pandemic. We chose these research methods due to ACU's restrictions for researching during the COVID-19 pandemic. These restrictions may have hindered the results of our study. In conclusion, this mixed methods study presented no issues with online learning during COVID-19. However, we did expose issues with mental health among students during the COVID-19 pandemic.